Good evening, Los Angeles. 365 days ago tonight, I issued an emergency order for the city of Los Angeles that called on Angelenos to make extraordinary sacrifices and to change the way that we lived in order to slow the spread of a new dangerous coronavirus that had landed on our shores. That night, we became one of the very first cities in America to start closing down what made our city so great. Our indoor dining, our bars, our gyms and theaters, the places where we gathered and found one another in months and years past, the things that made this city the city that it was. I can't believe it's been a year. I'm sure you can't either. But I can still feel that night, being here at City Hall, making the heaviest decisions of my life, but in some ways the easiest decisions I've ever made. Because I love this city like you. I love everything about it, its people, its neighborhoods, its life. And I was sworn to save and to protect those lives. And like each one of you, in the face of this darkness, we had to stumble through that moment, to find ourselves and to find our way. But we learned never to hesitate, to act, to move swiftly, because every life is sacred, is worth protecting. Everyone's livelihood matters to each one of us. We don't live in islands or bubbles. It's not just about our neighborhood or our household. It is about all of us. This virus taught us so much this past year. Not to wait, but to act. But it also humbled us. It humbled me as a leader. It humbled our nation as Americans. It humbled each one of us as human beings, something that we couldn't literally see, but that immediately we could see all around us, in empty streets and closed shops, in the deaths of loved ones. We could see our city grind to a halt. But one thing I promised is we'd never stop working, to not only save lives, but to protect the city that we love so much. Since then, for 365 days, right here from this podium, every day here at City Hall, I've never been able to summarize a day for all of us without a lot of loss and a lot of suffering, a lot of pain. But there also hasn't been a single day in that year when I haven't been proud of you and of our city, and proud to be an Angeleno in this place that's full of so much diversity, this place that is full of so much brilliance, and yes, this place that is filled with so much love, expressed in our darkest moments. For this year, I've had the honor of joining you from this podium to share with you information as soon as I get it, to communicate with you immediately so you could make the decisions to protect your loved ones, to find the relief that you need, and to understand this crazy virus that was mutating and evolving and going through all of our neighborhoods. It's not been an easy year. We all know that. For anyone, we've had to stumble through this darkness together, from the early moments of not understanding how this virus spreads to finding and seeing each other in ways I've never felt in my life. I remember those earliest press conferences, issuing a call one night on television for donations to help folks who were the survivors of domestic violence or restaurant workers who couldn't work. And by the time I ended these presentations, you had given enough resources for another day, for those families to meet the rent, for those individuals to survive to tomorrow. I remember watching as Angelenos, as this virus burned through our city, at great risk to themselves, started going door to door to find those seniors they hadn't heard from, who maybe they had never talked to before, and then set up weekly deliveries of food. Or the way we came together to find work for out-of-work taxi drivers and restaurant workers, to feed seniors who were by themselves at home, to help those who were the most vulnerable be able to get the medical care that they needed. And yes, those people on the front lines, from those stocking the shelves at the grocery stores to our incredible medical workers who have lived through so much trauma this year, who showed up day after day after day. Those drive-bys of the hospital, the ringing of bells at night, the thank yous that we said, the way our students stood up to thank medical workers, we saw the heart of the city and continue to every single day of this tragic year. We saw that spirit and we matched it with policy. We weren't just the first big city to close down our city. We were the first to issue a moratorium on evictions to keep people housed, the first big city to require the wearing of masks as soon as the evidence was clear that that saved lives, the first city to offer testing to all of its residents and then to all residents with or without symptoms. We changed the language of the lockdown from a shelter-in-place way of describing things that was more akin to a school shooting to a safer at-home understanding of what our responsibilities were and the opportunities we had. We established the largest rental assistance program in the United States of America, and since the start of the pandemic, we've brought nearly 8,000 unhoused Angelenos into shelter. And what we do here in Los Angeles matters, not just during this year. I've always known that as your mayor and as an Angeleno, but we showed it this year, because the things that we would pass here would become statewide policy and national policies, as suddenly Californians and Americans also had eviction moratoriums that prohibited their evictions in the midst of this pandemic. As we inspired others to have mask mandates, as we showed others what you could do when you reached out your hand for help and a neighbor grabbed it. We've been able to do this because of round-the-clock extraordinary people. Not just those medical workers and essential workers that I mentioned, but I want to thank my city team, tens of thousands of city workers who stepped up, who continued to work, who filled jobs they had never been trained for but knew that somebody had to do. Thank you from the bottom of my heart, because as we count those that we've lost, we can never count those that we still have because of you, but know that your work matters, and it has mattered this year. And we've seen such incredible generosity from everybody who's listening tonight. We can put a figure on that. In 365 days with more than 12,500 donations, more than $72 million that you've given to your fellow Angelenos, 100% of that going directly to those most in need through the Mayor's Fund, a lifeline for 255,000 people here in the city of Los Angeles. Whether it was the Angeleno card that helped more than 100,000 residents get direct cash assistance regardless of who they were or where they lived, their background or immigration status. The 1,000 domestic violence, sexual assault, and human trafficking victims who have a secure place to be. While everybody else had to shelter in home or to be safer at home, they had no place to go, but because of you, they do. Because of you, we provided childcare to essential employees who didn't know what would happen with their children as they went for another shift at the hospital, and hundreds and hundreds and hundreds of thousands of meals for our seniors. And today, Mayor's Fund is empowering vaccine equity, making sure vaccinations don't just go to the wealthiest zip codes of our city. And if you want to continue helping, we still need you at mayorsfundla.org. Give something tonight, and I promise you by next week, that's going to be out in the street in the form of a vaccine in the arm of somebody who otherwise might not have known that those vaccines were available to her. And we, a year on, see the rays of sunlight breaking through the clouds. Vaccines are here. We're on our way to a less restrictive tier. There are real reasons, my friends, to feel hope. But as a city and as individuals, I think we can't but look back at this year and realize that we're changed. We've endured great trauma and tragedy, and as I said from the beginning of this, I hope that you continue to look out for your spirit, for your own well-being, psychologically and spiritually, that you found those places and those people to connect with in these toughest moments. Even as we followed the best public health advice, looking back at 365 days, unfortunately, the toughest part of that is the more than 9,000 residents in the city of Los Angeles and the more than 22,000 residents of the county of Los Angeles who are no longer here. I'll speak very personally about this. When I became mayor, I figured maybe the toughest night I'd face would be coming before you to say the aftermath of an earthquake had hit our city. Certainly my predecessors, that was the greatest tragedies that they had faced. So we worked hard to try to strengthen our buildings and to take on the issue of earthquakes. But when I do the math now and I think about Northridge in 1994 when we lost 57 people in that horrible, horrible earthquake, we've averaged 60 deaths every single day for a year. That's like a Northridge earthquake for 365 days without letting up. I've shared those numbers, and we become so numb to the numbers. That's why I wanted to personalize it. There hasn't been a single day that I haven't had the news of somebody else that we've lost. A single week I haven't picked up the phone and talked to a widow or a widower, the children of somebody lost, a city worker's family or a metro operator's family who no longer is with us. I know that pain you still carry and that we can never fully repair. And those people we will never replace. These were parents and grandparents. These were our beloved neighbors and friends. These were teachers and nurses, healthcare workers, emergency responders, 56 employees and contractors of the city of LA and LA Metro, all of them just working to make LA better, to make it work, and to protect us in the midst of a pandemic where they couldn't stay home. 1 year after this battle has started, I want every family that has lost someone, or in some tragic cases, more than one person, that we see you, we mourn with you, we remember you. Tonight we light up City Hall red as a symbol of all that we have lost. Earlier I rang the bells up at the top of City Hall as we commemorate those souls that are still with us in our hearts but not here with us in our homes. And I know how hard it is to allow yourself to feel some optimism, but let me tell you, you have real reasons to be optimistic right now. In the midst of remembering that pain, after a year of tragedy and loss, our instinct might be to make ourselves numb, to steel ourselves for even more of the same. But even as we remain vigilant now, because we still can save lives more than at any point in the pandemic, I feel so grateful and I feel so optimistic. Grateful to be the mayor of this city and for all that you have done. And optimistic because the numbers clearly show that there is that hope right there, ready for us. Over this year, we've learned so much. Certainly, we've learned what to do and what not to do. We've seen true miracles of science, vaccines injected into people's arms in less than a year, mastering this virus, mapping new variants. We've gotten smarter, we've gotten stronger, we've become more resilient, and we've helped bring that hope to the horizon. And as the head of the CDC said this week, we are starting to turn a corner. That's not just true at the national level. It's abundantly clear here at the local level. In LA County, infections continue to drop. And since Friday, we had fewer than 1,000 daily cases, and we now have fewer than 1,000 people in our hospitals. Both of those incredible thresholds, unimaginable a month and a half ago. This is the first time in 3 months that those hospitalizations are under 1,000. It's the lowest number of patients in our intensive care units since November 4th and continuing to fall. These numbers aren't just progress on paper. They are really having an impact. And vaccines are working. We know this because for the first time, patients over 65 are fewer than patients under 65 in our COVID wards. Because so many seniors have begun to become vaccinated, we've seen their numbers, those most vulnerable population, come down so that they no longer are the majority of people in our COVID wards. And we learned that that good work, that positive behavior from all of us, that we've earned a step down to the red tier statewide, so that we're allowing more sectors 365 days after they were closed down with the congruence of today to open back up. Of course, this is with precautions, with safety, with all the things we've learned. When some say, how can we possibly do that? We didn't know what we know now back then. We didn't know that in terms of our own behavior. We didn't know that in terms of the protocols. We didn't know that in terms of the science of how this thing spread. But starting today, restaurants can open for indoor dining, either operating at 25% capacity or limiting guests to 100 people, whichever is fewer. There must be 8 feet of distance between tables. with 1 household for indoor dining per table. 3 households can now mix outside in outdoor dining. Indoor malls, as well as personal care services and retail, can operate at 50% capacity, something our local businesses I know have been waiting for. Gyms and fitness centers, yoga and dance studios can open their doors at 10% capacity with masking. Zoos and aquariums and museums can open indoors at 25% capacity, also with masking, along with movie theaters, which have to operate with reserved separated seating for groups. This is a welcome relief for businesses, for our city, for our sense of humanity and community. For workers and families across LA County, it's a sign that our actions are paying off. But let me make one thing clear. No businesses are mandated to open. When we reach these thresholds, take your time to make sure you build out the safe protocols, that you restudy them to be safe. If your business needs more time to get things off the ground, to put the right health and safety protocols in place, take that time. This is guidance, a first step in getting back to business. And you should reopen when you are ready to do so. And similarly, for those who are still vulnerable, it's not recommended that you go into those higher risk activities and areas. Wait till you're vaccinated. And as I'll mention, with so many more people eligible for vaccination, we hope that moment of your protection comes soon. For more information about what is now open that was not last week, go to covid19.lacounty.gov. All of this is great news, but it's not our ticket to abandon all of our precautions. This is a moment to be more careful, not to, as some have said, to have senioritis. Remember that senior year of high school where you just stopped studying and everything kind of went to pot. We have to do our part to finish this strong. Don't let all the good things you have done amount to nothing for another family or another individual who might lose their life because we let things up too quickly, or we say, I can fudge that rule, or I can do something the public health authorities don't allow. Nobody's looking. Let's double down on safety measures. The data shows if we can keep this up with our vaccinations at the same time, we can stay ahead of community spread and be in a much better place. We've seen time and time again how easily our progress can unravel. Now, those times we didn't have the vaccination, those moments we didn't have the estimated maybe 40 to 45% of our exposed population with some antibodies on top of another 10 or 15% vaccinated. But we know still there are too many people who have never had COVID-19, who are not vaccinated, who are vulnerable, and the variants that come forward can still wreak havoc. We know that we have to make sure that these improvements hold to avert another surge, to ensure that the relief for our businesses, for our communities, for our city is here to stay. First and foremost, continue to wear your mask. This still is our most effective tool, greater than even the vaccination, according to the health professionals, while we wait for everybody to be vaccinated in our fight against COVID-19. Second, keep on social distancing. You've got St. Patrick's Day and Passover and Easter and Ramadan and spring break all coming up. Those aren't excuses to break the rules of how many households can be together, especially indoors or in spaces that are dangerous. The CDC and county guidance on safe gatherings is easily obtainable at publichealth.lacounty.gov/coronavirus. And finally, get your vaccine as soon as possible. As more and more people are eligible, I know it can be frustrating. There's pinch points for the first couple weeks about whether there's any appointments available. But this vaccine will save your life, and that supply absolutely is coming, and it will help end the pandemic. The fewer people who get it, the longer this pandemic will last. And more Angelenos are now eligible. Last week, the county opened up vaccinations to janitorial and custodial workers, as well as our beloved public transit workers. And I'm pleased that starting today, dedicated public works employees who are responding to emergencies can also get vaccinated, along with people who have severe underlying health conditions eligible to get their shots, and folks living with disabilities that are in that guidance. And as a veteran myself, I am thrilled to announce that veterans of all ages are now eligible to get vaccines as well through our VA healthcare system. If you're enrolled with the VA Greater Los Angeles Healthcare System, you're encouraged to call the vaccine appointment line at 310-268-4900. Veterans, again, in the VA Greater Los Angeles Healthcare System can call 310-268-4900. And we can thank you yet again for your service to this country by ensuring that you have a vaccine. As you've protected us, we want to protect you. You can also go online to losangeles.va.gov to schedule an appointment. As of yesterday, we've neared on, as the city of Los Angeles at our city sites, nearly 2/3 vaccination doses across our sites. By the end of this week, we'll reach that threshold. Today, we've administered 610,922 vaccines and have over 55,000 doses available this week, first dose appointments, and we're going to give everybody the second dose appointment they're promised. At our mobile outreach for vaccine equity, those are the mobile teams that are out there in communities, not waiting for you to come to us, but us coming to you. In clinics in the hardest hit areas, we've partnered with trusted community organizations and continue to have extraordinary results. Over 24,000 shots, 91% of them have gone to people of color. And we've administered more than 98% of our city's vaccine supply, a sign of our efficiency. And as always, I thank our core workers, our LAFD workers, our folks who are partners from Curative and from Carbon, and all the clinicians that are putting those vaccines in arms every single day. I know it can still be frustrating. We're still in that phase of not enough vaccines for everybody that wants it. But the good news is we've seen in polls, and we've seen it even in our own vaccine facilities, that vaccine hesitancy is falling, and falling rapidly. More Americans realize that this is something good for them and their family. And those who might have wanted to wait are seeing what it does. To be able to hug a loved one, to be able to think about coming back in person to work, to be able to enjoy some of those things that are out there and opening up right now. We've heard from President Biden that that day is coming soon where all American adults who want a vaccine can get one. Before we know it, we'll be able to knock down this tier system and open the shot to anyone. But there are still appointments today for those who do qualify at city-run sites for those who are currently eligible. And you can sign up for an appointment or to get updates, Facts, our newsletter that tells you all the information you need at coronavirus.lacity.org/vaxappointment. Keeping Angelenos safe from the beginning of this crisis has been my guiding light, my northern star in everything and every decision I've made. And as COVID-19 has shown, that's not the mission just for a mayor, that's a mission for every Angeleno, all 4 million of us. As we've seen violent crime fall overall and property crime fall overall in 2020, we nevertheless have seen, not just in Los Angeles, but across our country, a disturbing uptick in gun crime and in homicides. It's a symptom of the spillover of the psychic toll of this pandemic. This weekend, Angelenos can do something about that. There's more guns and more ammunition that's been purchased in 2020 than in a long time. But you can create a safer city by joining me in our annual anonymous gun buyback, helping take firearms off our streets, and with fewer firearms, making our communities safer for everyone. So if you have a firearm that you don't want, we will give you something nice to take it off of your hands. We will pay you. We will give you a cash card if you come to us with that firearm. No questions asked, no information requested. So here's how it works. On Saturday, March 20th, bring in your guns to one of 2 locations, in the Valley to the Van Nuys Masonic Building Association, or to the Volunteers of America in South LA. LAPD will assign a value to your firearm depending on its condition, up to $100 for handguns, shotguns, and rifles, up to $200 for assault weapons. And again, this is completely anonymous, no questions asked. For more information, please check out this website at LA Grid, that's spelled GRYD, so that's LAGRYD, our Gang Reduction and Youth Development Program, which is an example of an unarmed response and an intervention program that works in LA. They are overseeing that, so if you go to lagryd.org, we'll get all the information, or just come on Saturday to those 2 locations in Van Nuys and South LA. Friends, it's hard to believe that a year has gone by. And it's devastating to think the pain and suffering that we've had to hold on our shoulders. Maybe you're the head of a household who had hours reduced and didn't know how you'd support your family. Maybe you're somebody who worried about making the rent and worried you'd become homeless. Maybe you lost your parent or a cousin or a sibling. Maybe you're mourning what happened to your business when it shut down and hasn't come back. I know how tough this year has been. It's been a brutal year. It has taken so much out of us. But we are Los Angeles. We are resilient and we are loving. We are tough. We are smart. You embody those qualities, and I've seen that. I've been able to witness that as your mayor, not only as I've moved through the city during this pandemic, but the notes that you send, the emails, the stories that I hear on the ground showing that this truly is a city of angels. I've always said that nobody should bet against LA, and I certainly don't. We've confronted big challenges before. We always come out of them stronger than we were before. We're a city of dreamers, but we're also a city of doers. A city that inspires the world on the silver screen, a city that looks to the stars and builds the rockets and rovers to reach them, a city that welcomes the world, a place where everyone belongs, a city that will welcome everyone from this earth in 2028 for our Olympics and Paralympics, a place where cultures intersect, where justice is our guide, where everybody finds their place. So 1 year later, how has COVID changed you? Who are we as a city? As we light up City Hall to mourn those that we have lost, as we remember together, I promise you, we won't just respond to this crisis. We will rebuild from it. And we will have the courage to reimagine an even better city that is built from the ashes of this tragedy. As we look forward to this year of unprecedented opportunity, we recall a year of unprecedented challenge. There's a poem by the great Chicano poet José Montoya, El Sol y los de Abajo. And in it, it ends, the dust that darkened the air begins to clear. Y se empieza a ver el sol. One can begin to see the sun. I am learning to see the sun. Those words resonate for each one of us that needs to learn again. It's not easy to come out of the darkness, to feel that sun on our skin, to recognize the hope that still lurks someplace deep inside of us, but also all around us in this city. As we mourn the past, as we feel our anxiousness about the future, let me tell you, Angelinos, we are still full of the strength and the love that defines us. I'd ask us all for a moment of silence for everyone that we have lost. Thank you. With that, I'm happy to take questions. First question, please. Thank you.
Our first question comes from the line of Claudia Pesciutia with KNX News Radio. Please go ahead.
Hey, Claudia.
Hi, Eric. I'm going to ask you a list of questions. This is a little hard for me to hear you off mic, so I'll get them all in right now. And yeah. Okay. So as mayor, what's been the worst moment of this year for you? Number 2, you're vaccinated. Would you dine indoors right now? 3, vaccine eligibility has been expanded to all homeless adults. Does the city plan to expand efforts to get shots to them? If so, how? And if a homeless person can get themselves to walk up or drive through vaccination site, will they be able to get vaccinated there? If so, how would they prove eligibility? And then based on what you know, do you think California will go to the age-based eligibility system or just skip it and open up vaccinations for all adults on May 1st? Thank you.
Thank you, Claudia. Appreciate your presence this entire year. In terms of the state stuff, I think I can't speak for them, so I don't know, and I wouldn't want to predict. I think that there's a good shot that probably at some point they'll go to age-based and lower until the day when all tiers or age or profession requirements are completely eliminated. It's difficult for me to see that being much more than, say, 2 months out from now, but it could come even earlier than that, a month or so. But as I said, each time the eligibility opens up, for instance, people living with a disability that qualify right now, the folks now that are in different sectors that are eligible to be vaccinated, there's usually always more people qualified than vaccine supply. And it still is frustrating, I'll be honest, to see the city's allocation. And I had a meeting that I led with mayors from across the country with the White House and expressed this to them. And the White House has done extraordinary work. I've been very pleased to see the federal sites, the mobile site that they have, et cetera. But I said, if you want to really, ramp things up, we're only at 43% of our capacity. Give us more directly, and don't filter it. The system filters through states. That probably works great in smaller states, but we're this, larger than 23 states. LA County's larger than 45 states. So I'm hopeful that we could do that. I don't know. And certainly if I had enough supply, I'd knock down those tiers very quickly and just kind of start saying, if you live in a given area, we'll vaccinate you, and shortly thereafter, anybody who wants one, come through. In terms of people experiencing homelessness, this has been a very high priority, as you know, throughout the pandemic for me. I'm still very pleased to report that people experiencing homelessness have a lower case rate, positivity rate than people who are housed through very conscious public policy interventions, whether it's health visits on the streets, mass distributions, Project Room Key, and some of the shelters that we've stood up. And we started testing being able to give vaccinations going to folks directly. Obviously, I think that's going to be the best, and we have plans to be able to scale that up as soon as we get enough vaccines. I think for people who are not in a congregate setting, so if they're literally on the streets or someplace, it'll be difficult to find them a second time. Johnson & Johnson, which, by the way, is contrary to people's beliefs, selling like hotcakes. A lot of people really want Johnson & Johnson. Occasionally, some people say, I want the 2-dose. But when we tested that out at Pierce College in the West Valley, people really loved it because you can return to activities recommended 2 weeks from that date instead of 6 weeks later with Moderna and 2 shots, or 5 weeks later with Pfizer and 2 shots. We tested that also in a Bridge Home facility with over 100 people experiencing homelessness, had very strong results. And as you can imagine, with folks who are living on the streets who already are traumatized or have mental health issues, getting somebody convinced to get themselves vaccinated can, with some people, prove extra challenging. So for them to have trusted people that they know who are part of feeding programs, who are part of case management programs, getting the vaccinations at the same time, really convinced a lot of those folks to do it too, and that's a model we want to build on. In terms of dining indoors, I would. I don't have immediate plans to, but I have stubbornly followed the public health, the medical, and the medical advice and the scientific advice throughout this. I talked with Dr. Ferrer. I think it is now something, as long as restaurants are, and please do tell us if folks aren't abiding by 8 feet, if you see multiple households mixing indoors. And I'd ask all our restaurateurs to really be careful about those in those first few weeks so that we don't see another outbreak, we don't see another peak. So I don't have any plans to, but I would, yes. And the worst moment, Claudia, it is so difficult to sift through 365 days of more tragedy than I've probably lived through in my entire life. But I think the toughest moments, the kind of one the same, is just picking up the phone and asking a loved one, tell me about your father, tell me about your grandmother, and just sitting there and crying with somebody as they describe what incredible human beings we've lost. I hated the coverage early on when people are saying, oh, this is mostly like old people and folks in nursing homes, as if their lives were somehow over. When you listen to the sadness of what we lost, the wisdom, the stories, the moments for grandchildren to learn from grandparents, by far worse than anything else has been just that loss of human history, of human possibility, and the sadness of mourning alongside families. Thanks, Claudia. Next question, please.
Our next question comes to the line of Dakota Smith with LA Times. Please go ahead.
Hi, Dakota.
Good evening, Mayor. I had a question about the $5 an hour pay for grocery store workers. As you know, 3 grocery stores are going to be shutting down because owner Kroger said it can't afford to keep them open. There's some community anger about those shutdowns. There's a campaign to keep the Ralphs on Pico Boulevard from shutting down, in part because it has a pretty extensive kosher section. Kroger is saying that it will seek to move all of the employees who work at those stores to other stores to avoid layoffs, but since you did support the extra pay for workers, can you address concerns about the stores closing? Sure. And if there's anything you know about the Pico Ralph that you want to say, that would be great too. Thanks.
Thank you, Dakota. Yeah, I'm very disappointed to hear that Kroger, with record profits, is going to close those stores down, especially when this measure that is passed is a temporary measure during this time, that we can't acknowledge that these are heroes, pay them as they were, but not consistently as heroes, and take some of those record profits and record pay that executives and others have had and share that with the people who are generating that wealth in the midst of the most dangerous working conditions in our lifetime. I think it's reprehensible. It was unfortunate to also see, I'm glad you brought it up, I know that store on Pico, it serves the Orthodox community. It's one of the most important places to get kosher food in Los Angeles. So it's not just the closure of any place. But also I know the Food for Less on Sunset Boulevard in East Hollywood. That was traditionally been a food desert where there haven't been grocery stores. And to take vulnerable communities or specialized communities and to somehow seemingly punish them, I would hope that, yes, of course, there's always more profitable stores than not, but the idea that a temporary bump of $5 for folks that have put their lives on the line can't be weathered by a company that more than doubled its profits doesn't seem to compute. It doesn't meet the test of basic math. And I tell my friends at Kroger, really rethink that. Let's figure out a way together to maybe make this a national example and be lifted up. Look, I mean, there's companies that have led the way on that. I certainly support the right of workers to organize, and there's campaigns about this with large companies. And there's plenty of criticism that can be leveled at some of our largest companies in the country for things they haven't done. But for instance, when Amazon boosted their basic pay to $15 an hour nationally, that was an example of a company that heard the criticism and did something about it. It doesn't mean everything's perfect tomorrow, but I would hope that Kroger would take that path. I'd look forward to working with them and lifting them up as an example, rather than having to unfortunately see the impact of this in our communities, for our Jewish community, for our heavily Latino and Asian Pacific Islander community and Armenian community in East Hollywood, and the third store as well in South LA. Thank you. Next question, please.
A few others have just queued up towards the end of that, so one moment while we take their name.
Okay. Go ahead. You can go ahead and put them right through. Don't worry. You don't have to announce them. They can just announce themselves.
All right. Our first question comes to the line of John
Regardi
with Los Angeles Magazine. Please go ahead.
Thanks. Hey, John.
Hello, Mayor. Two quick questions for you. One, the economy is reopening, obviously, but do you have an anticipated timeline for when some city facilities will begin to reopen, libraries, parks, even City Hall? And beyond that, we spoke early in this crisis, and I remember you saying how you had studied pandemics. You had said that you predicted ultimately between 5,000 and 20,000 deaths in Los Angeles. And you also predicted there would be steps forward and backwards, stressing the progress would often be what you called fragile. And a lot of that's come to fruition. We've had openings and closings, but now today here we are with more than 22,000 Angelinos have died, and this is a full year later. As you look back, Mayor, was this pandemic worse or beyond what you had expected, anticipated?
Wow. So I think for the county, I had projections as much as 50,000, and that was a countywide projection of the that was a citywide projection of the 5 to 20,000 deaths. So at 9,000 deaths, I guess it's towards the lower end of that range. But I mean, it's a pretty morose thing to celebrate only 9,000 deaths when there could have been 20,000. That's, 10 deaths would have been a tragedy, 100 deaths, 1,000 deaths. I'm convinced, though, a much lower number than I think we were headed to. If you saw the surge that happened in New York, I mean, we'd still have to have more than twice as many people per capita die to match what we saw in other cities. I always look at these numbers and these statistics, but we'd still be somewhere in the middle of the pack in terms of the country. And when I looked at some of the worst projections early on, and people were saying, look, that close to 100% of people could get this, and 2% of those could die, 2 to 5% could die, that would have been 200,000 to 500,000 LA County residents. We sit here today at 22,000. So I hate this because you don't celebrate anything when there's that many people that die. It's the most that have ever died. But I do think that the work that collectively Angelenos did saved more lives than we will ever save in our lives. In a single swoop, with a mask, with distance, by washing a hand, by shutting things down quickly. I mean, we bought 10 days more than New York had, and look at the impact. We went earlier, and they were a little further progressed in their infections. So I absolutely look back in a positive way with what Angelenos have summoned in order to make sure that we didn't have an even more tragic year. But there's no way to look back at this year without deep sadness, without stomaching that deep suffering. And along the way, I think a lot of the predictions, whether it's that the economy comes back more quickly from a pandemic than people expect, I hope that one comes true. Whether it's the worst case scenario, when we looked 100 years ago, if we'd lost the same percentage of Americans as the flu epidemic of 1918, we would be, I think, in the tens of millions. We were able to get through this in a way that many people are with us that otherwise would not have been, and that's something that's a silver lining in an otherwise very tragic year. Any follow-on? Oh, the city facilities. Sorry, I didn't answer your first question. City facilities. Yeah, go ahead, John. Sorry, I didn't mean to interrupt. You got it. Okay. So city facilities. We don't have dates for those yet. I really want us to see this red tier, whether we can continue going down and or hold. For instance, for the first time, the county is projecting that the R0, remember the rate of infection is going to go up, still under 1, so cases should continue to go down, but that R0 has been going down and down. They think with the red tier, it's just natural with some more openings, there's some more spread that can happen. Obviously on balance and in terms of safety, they're recommending we do it. But no, I would think that city facilities were still at least a couple months off. We have no immediate plans for folks that are telecommuting as city workers to come back. We still got to get through, I think, this main hump of vaccinations. We're on this upward climb in terms of the quantity. I hope in the next 6 weeks or so, 8 weeks max, we'll be up here of really vaccinating a lot of people. And then I think we can consider opening up those libraries, opening up more city facilities. But we've done that with some. Zoo obviously has opened up. There's some outdoor spaces. All of our rec and parks facilities and playgrounds, those things are open. But just continue to use good judgment. And I hope that in the next month and a half, 2 months, we'll be able to be in a tier where that is safe. Thanks, John. Next, you bet. Next question.
Our next question comes from Shahan Ahmed with NBC Los Angeles. Please go ahead.
Hey, how you doing?
Hi, Mr. Mayor. I had a question somewhat related to what you just answered, but a little bit more expansive.
Sure.
With regards to sports leagues and the Lakers and Clippers and Kings kind of getting fans back in the stands, what type of conversations have you had, discussions have you had to where we can potentially get, even if it's a partial number of fans into arenas, and what type of timeline do you see that happening? Do you think by March, April, May, or into the playoffs? When do you think we'll start seeing fans back in there? And does the vaccine passport or that idea or concept play into it at all?
Personally, I love the idea of show us you've been vaccinated, and we know the guidance from CDC, from our county public health, from the state, is that you can do much more, even indoors, if you've been vaccinated and you're with people who have been vaccinated. So I think that opens the door to even indoor. The governor's talked about outdoor and baseball by April, by the time it's opening day. That's exciting to me. It'd be at limited capacity, but even Dodger Stadium filled at 10 or 25%, where people can be safely away from each other. We've seen and learned this year outdoor risk is much, much lower than indoor. And for the indoor ones, absolutely. I want vaccines to come with something good. I don't want it just to be something we all have to slog through. But as I said last week, getting to hug my parents was welcome. Reading that CDC advice of being able to be indoors with other people who have been vaccinated is certainly welcome after a year. And I want all Angelenos to be able to experience that. So we don't have dates yet for NBA. I would hope by playoffs when one or both of our LA teams is in the playoffs, both of them should get there. We could at least at some limited capacity have fans back. So to me, that is an absolutely realistic timeline with the projections the vaccines are looking at right now. Any follow-on?
Thank you.
Okay, thank you. Next question.
Our next question comes to the line of Joel Pollack with Breitbart. Please go ahead.
Hey, Joel.
Hi, Mr. Mayor. I was wondering if I could get your reaction to the performance at the Grammys yesterday when Los Angeles was depicted in the Black Lives Matter protests, and there was a scene of a confrontation with police, some burning buildings. There was a speaker, Tamika Mallory, who's been associated with Louis Farrakhan. And I was just wondering what your reaction was, if you saw the performance and how you felt about it.
I didn't, Joel. I didn't see it at all. This is the first I actually learned of it right now, so I couldn't respond to it. Happy to look at it and respond at another briefing. You always ask some of the best questions. I had to think of Dr. Seuss last time and respond to the Grammys. I was really glad we could do the Grammys. That's about as much as I know of them, is we worked really hard with the Recording Academy to make sure that they could have a presence here in an affordable way through our convention center, but I haven't seen that, so I'm sorry I can't comment on it. But thanks, Joel. Appreciate it. All right. As always, I will go to Spanish now. Thank you, everybody, as well, for tuning in. Thank you for your strength during this year, and I'll see you soon. Buenas tardes, Los Ángeles. Hace un año hoy anuncié un orden de emergencia con enormes cambios, pidiendo grandes sacrificios para frenar la propagación del coronavirus. Fuimos una de las primeras ciudades de los Estados Unidos en cerrar comedores al interior, bares y otros lugares donde se reúne la gente. Hace un año no sabíamos el alcance de la crisis delante de nosotros y no imaginábamos el impacto que tendría en nuestras familias y comunidades. Y aún con el temor y la ansiedad sobre lo desconocido, los angelinos hicieron su parte. Con fuerza y coraje, hicimos lo necesario para proteger la vida humana y apoyar a nuestros vecinos más vulnerables. Desde el primer día, diseñamos nuestros programas para enfrentar problemas de desigualdad directamente. Hace un año, Los Ángeles se convirtió en la primera ciudad en declarar una moratoria de desalojos. Además, fuimos la primera gran ciudad en exigir el uso de mascarillas y ofrecer pruebas a todos sus residentes, con o sin síntomas. Lanzamos el mayor programa de asistencia de alquiler de emergencia en la nación y logramos alojar a 8,000 angelinos sin hogar. Mucho de esto lo debemos a la generosidad de tantos angelinos. Gracias por su generosidad. Y hoy puedo decirles que en el último año, angelinos han donado un total de $72 millones al Mayoral Fund de Los Ángeles, ayudando a más de 255,000 de nuestros residentes. Increíble. Esto incluye ofrecer asistencia financiera a más de 100,000 residentes que perdieron sus ingresos durante la pandemia y ayuda a más de 1,000 víctimas de violencia doméstica o tráfico humano. Además, ha proporcionado fondos para el cuidado infantil de empleados esenciales y la entrega de más de 3 millones de comidas para personas mayores. Y hoy, este fondo está impulsando nuestro trabajo para asegurar la equidad de acceso a vacunas. Estoy tan agradecido a todos quienes han podido donar a este fondo Si usted puede, lo invito a donar en mayorsfundla.org. Un año después, tenemos razón para sentir esperanza. Las vacunas están aquí. Hoy nos estamos moviendo a un nivel menos restrictivo. Sin embargo, como todos, hemos sufrido mucho también. Hemos perdido más de 9,000 residentes de la ciudad de Los Ángeles y más de 22,000 residentes en el condado de Los Ángeles. Eran padres, eran abuelos, maestros, enfermeros, vecinos queridos y personas admiradas en sus comunidades. Eran trabajadores de salud, de emergencia, 56 empleados de la ciudad y de Los Ángeles y el metro, todos trabajando para proteger a Los Ángeles, a servirnos. Quiero que cada persona en Los Ángeles sepa que no están solos. Nuestra ciudad está de luto con usted y con su familia, y les ofrecemos consuelo y esperanza. Finalmente, hay señales de que las cosas están mejorando. En el condado de Los Ángeles, las infecciones continúan bajando, con un promedio actual de 1,005 casos en 7 días. En las últimas 8 semanas, las hospitalizaciones han bajado y el número de pacientes en nuestras unidades de cuidados intensivos se encuentra en su nivel más bajo desde el 4 de noviembre. A partir de hoy, el condado de Los Ángeles se ha movido al nivel menos restrictivo del estado, el nivel rojo, permitiendo que más sectores en Los Ángeles abran con limitaciones. Empezando hoy, los restaurantes pueden abrir sus comedores al interior, operando 25% de capacidad o limitando a 100 personas, lo que sea menor. Los centros comerciales al interior pueden operar al 50% de capacidad. Ayuda para nuestros negocios locales. Los gimnasios y estudios de yoga y danza pueden abrir al 10% de su capacidad con mascarillas. Los zoológicos, acuarios y museos pueden abrir con un 25% de capacidad, junto con los cines que deben operar con asientos reservados y separados para grupos. Esto es un gran alivio para tantos negocios, pero quiero dejar claro, los negocios no están obligados a abrir. Si su negocio necesita más tiempo para implementar los protocolos de salud, tome este tiempo, es crítico. Para obtener más detalles sobre estas pautas, visite covid19.lacounty.gov. Todo esto es una buena noticia, pero todavía tenemos que mantener las precauciones adecuadas para protegernos. Hemos visto cómo tan rápido podemos perder nuestro progreso y necesitamos tiempo para seguir vacunando a nuestra ciudad. Sigue usando una mascarilla, mantenga la sana distancia y por favor no se reúna en el día de San Patricio. Siga las guías de la CDC y del condado sobre cómo reunirse de manera segura. Están disponibles en publichealth.lacounty.gov/coronavirus. Finalmente, vacúnese cuando usted es elegible. Salvará su vida, la vida de alguien que ama y ayudará a acabar con la pandemia. La semana pasada, el Departamento de Salud Pública del condado abrió las vacunaciones a los trabajadores de limpieza y custodia y del transporte público. Y a partir de hoy, personas con ciertas discapacidades y condiciones subyacentes también son elegibles para obtener sus vacunas. Como un veterano, estoy muy encantado de anunciar que las vacunas ahora también están abiertas a los veteranos de todas las edades que son elegibles para la atención médica de la Administración de Salud de los Veteranos. Llame al 310-268-4900 o visite losangeles.ba.gov para programar una cita. A partir de ayer, la ciudad de Los Ángeles ha administrado 610,922 dosis de vacunas en nuestros centros. Y vamos a ofrecer cerca de 55,000 citas para la primera dosis esta semana. En nuestras clínicas de vacunación móviles, colaboramos con organizaciones comunitarias para alcanzar vecindarios de mayor necesidad y hemos administrado más de 23,897 vacunas, por lo menos el 91% de las cuales han sido para personas de color. Y hemos administrado más del 98% de la provisión que hemos recibido. Aunque los hombres han fallecido a causa del COVID más que las mujeres, se están vacunando menos. A los padres, hijos, hermanos, tíos, primos, abuelos, por favor, tomen el paso para vacunarse. Aún no tenemos suficientes vacunas para cada angelino, pero supimos del presidente Biden que ya pronto van a llegar. Hay citas disponibles en los sitios de la ciudad ahora para las personas que son elegibles. Visite coronavirus.lcity.org/vax appointment para programar una cita o llámanos a 311. Mantener la seguridad de los angelinos siempre ha sido nuestra prioridad y esa misión nos corresponde a todos. Este fin de semana, angelinos pueden participar en nuestro programa anual anónimo de recompra de armas. Si tiene armas de fuego, queremos pagarle para tomarlas, sin hacer preguntas y sin pedir información. Este sábado, 20 de marzo, traiga sus armas a uno de dos lugares: la Asociación de Edificios Masónicos de Van Nuys, en el Valle de San Fernando, o Voluntarios de América, en el sur de Los Ángeles. El Departamento de Policía de Los Ángeles asignará un valor a su arma de fuego, hasta $100 para pistolas, escopetas y rifles, y hasta $200 para armas de asalto. Para más información, por favor visite el sitio web de mi Oficina de Reducción de Pandillas y Desarrollo Juvenil en lagryd.org o llámanos a 311. Amigos, hermanos y hermanas, es difícil creer que haya pasado un año desde que nuestras vidas cambiaron. Pero Los Ángeles siempre hemos sido fuertes y lo somos ahora. Esta noche iluminaremos la alcaldía de rojo para recordar a todos quienes hemos perdido. Y mientras hacemos lo necesario para recuperarnos, seguimos buscando la esperanza para llevarnos adelante. Quédense sanos y seguros. Fuerza y amor, Los Ángeles. Y gracias por su amor. Buenas noches.